One of the frequently asked questions we get is that if we have had crowns or a full mouth reconstruction or major dentistry done, are we still susceptible to gum disease? And one of the things to remember is that gum disease is a disease that affects the tissues around the teeth. It has nothing to do with the tops of teeth or the crowns of the teeth. It has to do with the bones and ligaments and roots of the teeth. And so what I want to tell you is that if you've invested in your mouth and you've had major dentistry done or even just a few crowns, you definitely need to make sure that you're regularly checked for the early signs of gum disease. Gum disease is often painless. You can notice sort of maybe bad breath or some bleeding gums, but it doesn't hurt in the way a traditional dental problem would. And so by seeing a dentist, by seeing a hygienist regularly as part of your exam, we will measure around the teeth and see that if you're developing these signs. And the good news is that if we catch these things early enough, we can definitely take care of it for you. But just so we're clear, let's just take a quick look at our video monitor here to look at some animations so we have a clear understanding of what gum disease is and what we're going to do for you to prevent it and get rid of it should you be susceptible. So this is a Guru. It's a patient education software package we utilize with our patients. And we're just going to look at a cross-section of the jaw here and get a little closer. Again, what I want you to pay attention to is that there is a little space, natural space that exists between your gum and your tooth, and it's this little area that we have to make sure that you have the ability to keep clean. Because if bacteria can get in there, what happens is the tartar will set up shop underneath the gum, it will set up some inflammation, and then gradually it can start breaking the bone around your teeth. So it's that losing this bone level that as it migrates downward is the very thing that can cause the teeth to get loose and ultimately lose them. So what I want to tell you is that, I don't want to scare you, but just understand that regular visits with your dentist and dental hygienist, no matter how much dentistry you've done to the tops of the teeth, it's the gum part that we've got to keep a close eye on. This is the link between you and your health. And the other thing to really remember is that we now have evidence that having gum issues and inflammation and bacteria around the roots affects you systemically, and it's even been linked to heart disease. So all these things that we have known for a long time with regards to the health of your mouth will also affect your general health. So what I would tell you is see your dentist regularly, get your teeth cleaned regularly, and make sure you have that regular check for gum disease, and we should be able to prevent that issue for the rest of your life.